And we are live. Welcome, everyone. This is Dr. Philip Ovadia. Welcome to another one of our iFix Hearts live streams. Got a really interesting guest lined up for us today. I personally am pretty excited for this conversation. So today we have Matthew Chang from Chang Robotics. And I'm sure many of you are wondering what a metabolic health expert and heart surgeon is going to talk to a robotics and AI guy about. But like I said, this should be a banger of a conversation. So before we get into it, Matt, why don't you introduce yourself to the audience? Maybe just give a little bit of your background, talk about how you got into robotics, because that's not something we talk about a lot here. And then we'll go from there.
Yeah, super. Well, thanks for having me, Dr. Ovadia. Loved your book. So maybe how a lot of us met you. Yeah, my name is Matt Chang, and I run a robotics company called Chang Robotics. I got into robotics by accident. And it was after I endeavored to become, a real engineer. And so I went to Georgia Tech and I followed the traditional professional engineering route and becoming licensed as a PE, somewhat analogous to becoming a medical doctor. We're regulated by the state, and there's a lot of steps in the middle to kind of reach that level. And so I was happily practicing professional engineering and designing advanced manufacturing facilities for the first 2/3 of my career. And I got to do that kind of globally. I did it, of course, all over the US. I did Europe and the Middle East and China and Southeast Asia. So it was really kind of like a joint engineering, see the world type of career. And then all that changed when I got fired from a job. And my wife said, "Hey, didn't you always want to start your own company? Seems like today's the day." So that's what I did. And when I opened my practice, it was just going to be an engineering company to design factories. That's what I'd always done. What I learned quickly within the first few months of business was I was never going to win any work unless I had 1,000 engineers and a huge balance sheet. But what all the customers gave me that I was pursuing as a consolation prize was they said, "Hey, we can't hand you the design of this whole facility, but what we would like to do is have you figure out how to do robotics for us." And so that kept coming up. So by the end of year one, we were solely focused on robotics. And as we sit here today, we've been able to design and install a number of industry-defining use cases, especially around autonomous robotics is our passion.
Awesome. And I know that you've had some interactions, we'll say, with the healthcare system, and you have some projects related around that. Maybe we can talk a little bit about, why doctors or why the healthcare system in general, maybe should be thinking about robotics, should be thinking about AI. I'd love to hear, I know you mentioned you have sort of an autonomous hospital project, which can sound kind of scary maybe to patients, but talk a little bit what that actually looks like and how these things are entering the healthcare arena.
Yeah, absolutely. Well, so there's already a lot of robotics in hospitals, as you know. In certain areas of surgery, the surgeons are now doing more surgeries with robotics than without. And so the way we look at it, there's two sides to a hospital. There's the clinical side, and then there's the operational side. The side that we decided to focus on was the operational side. There are many good companies doing clinical robotics for lab testing and surgeries and these sort of functions. Where we decided to focus in was we do the robotics to help the operation of the hospital. So our main customer is the nurses. If we can make robots that work with nurses and that nurses like using, then our system works. And so as we sit here today, we've got a great success story to talk about.
Yeah, I mean, I think people, may not realize, right, some of the inefficiencies in hospitals that can be solved with things like robotics, right? And a simple thing like, when the nurse is trying to give medications out to patients, right, and she or he, the nurse, right, has to go back and forth between the machine that dispenses the pharmaceuticals most commonly today, as opposed to you, from what I understand, have like robots that will kind of follow the nurse around, right? Or they'll go room to room, and some of this distribution can actually be automated. And now the nurse just has to kind of oversee things instead of doing all that work themselves.
Totally. Yeah. So I'll break down the numbers in case your audience is a little bit curious on the math. So what we learned, and I give credit to my mother, who was a 40-year hospital RN. And so she was my kind of secret weapon as we developed this technology concept in making the first autonomous hospital in America. But what we discovered was 40% of a nurse's day is running around, like you just said, going to get medication, going to get supplies, food and drinks, and a lot of paperwork. So only 60% of a nurse's day is doing actual nursing. 40% is running around. To put it in context, it's about 10 miles a day that they can walk. So it's pretty intense. That's why the nurses are so obsessed with the special shoes they wear. And so what we said was, well, if the nation has a 10% nursing shortage, but they're spending 40% of their day doing something non-productive, if we could just take a bite out of that, we could solve the nursing shortage. So that's what we did. And what we designed was an autonomous robot system that goes to get the things the nurses needs and then brings it to them, but they don't have to ask for it. And so, you're pretty up to speed with modern healthcare. Every nurse is already a connected worker. In any hospital in America, they have a tablet or a phone or a scan gun. They have some device they're using for charts and to order supplies. So what we did was we made it completely invisible to the nurse. We plugged into the back end of their ERP, the operating system of the hospital. And so when the nurse goes to a room and makes an order, some of those orders are connected to our autonomous robot system, and it drives around the hospital, up and down elevators, to supply rooms, to pharmacies, wherever it needs to go, grabs those supplies and brings them back. And the challenge was it can't take a long time. We felt the biggest barrier to adoption was that nurses would get frustrated if they were waiting, then they'll just go do it themselves. And that would be detrimental to the success of what we're trying to do. So what we signed up for was 90-second prime. Every piece of inventory, that's how we look at it, inventory. Every piece of inventory we can bring to a nurse is delivered within 90 seconds of order. And so that's a commitment we made to our hospital client, and then it's one we delivered on, and that's been in operation since February 7th this year in the first fully autonomous hospital.
Yeah, I mean, that's just amazing to think about, right? And the things that I think about, right, in the context of what I talk about, empowering patients to take back control of their health, and having the opportunity now, right, for that nurse, for instance, to spend time at the bedside with the patient, talking about things like diet and lifestyle. Besides solving the workforce shortage that we have, we can also think about how nurses, doctors, right, all of the practitioners at the hospitals can have their time freed up to start to do things that are actually going to benefit the patient, rather than spending all their time, like you said, just trying to get the basics done for the patient, right? That's a lot of the struggle that we have, is we spend so much time just trying to take care of the basic needs, right, to keep the patient alive, essentially, that there's no way that we can consider introducing things like, well, let's have a conversation about your diet and your lifestyle and things like that.
Yeah, absolutely. And I think, nurses specifically, kind of their first job is to comfort, right? That's, if I was going to characterize it, at least that's the way I view it through my own mom. If they're so busy because they're running around, then they're not able to provide that kind of comforting bedside manner that's so critical. The patients in a hospital are their most sensitive time in life, right? So I think we've really moved the needle there. We've now surveyed the nurses post go live, and it's at a 96% acceptance rate. And I figure the nurses are a hard crowd to win over, especially with new tech. They've had new tech rammed down their throat every year they've been at work. And so to have that type of success, I think it meant we kind of paid attention to the right details and we focused on what they actually wanted to do their job. And that's the way we see it is we're helping the nurses do their job. After a nurse works in a hospital that's been upgraded with this format of robotics, it's going to be hard for them to want to work somewhere else because they know they have to go back to kind of the Stone Age of doing things.
Yeah, I'm old enough to have gone through the transition when we basically moved away from all the paper charting, to the electronic medical records. And I can tell you there certainly were not 90% acceptance rates of that. And, most everyone involved was dragged, kicking and screaming. But now, it's like when the electronic record goes down at the hospital, which is fortunately quite rare, but it's kind of like full on panic and no one wants to function without it. So that's pretty cool that you were able to get such good acceptance up front. I guess, and maybe this is a little bit broader than healthcare, right? But healthcare does have some what are at least perceived to be unique barriers to new technologies. And I'd love to see how you kind of think about, introducing these things in the healthcare environment and what kind of challenges there are around that.
Yeah, I think the biggest barrier for us is just the medical community is very slow on the pace of adoption. Sometimes, especially if we spend time on the internet, we kind of start to think like that and fail fast. And as you know, the medical industry is a fail never. And if it's not broke, don't fix it, right? Type of culture. So that's one of the things we're finding. There's a very huge desire to have new things, but a very slow adoption rate to try new things. What we've decided to do is we are focusing our bets in terms of what is breakthrough technology for the medical industry. And breakthrough technology is going to be a mix of hardware and AI in our view. So in addition to our own product that we just described, which are these nursing bots, we've also gone out this year and we've invested in 4 different medical technology companies that are that mix of hardware and AI. And so right now we're into imaging. We've got a wonderful investment in a company that's doing a miniaturized portable X-ray. Their kind of breakthrough for healthcare providers is there's no PPE and training required. And that was a very rigorous FDA approval that they got. The barrier to entry is you got to get through the FDA, and that's not a small lift. So we call that democratizing imaging. We're excited for what that's going to turn into for just radiology and imaging in general. Another one is right down your area of passion, which is metabolic health. So we're invested into a metabolic health AI company. And I'm very skeptical about most AIs. I've been dealing with AI and designing it, installing it since 2017. So all the new fad around language models, it's fun. I use them, but it wasn't surprising to me. This company made a difference. They took a facial scan of me and then made a metabolic blood panel prediction. And I read the results. I didn't love the results. I said, this is silly. And the founder challenged me. He said, well, go to Quest and get your own lab work done. And I did, and the numbers were the same. I said, that's insane that you just gave me a Quest quality metabolic panel with a 60-second face scan. So that's a company that started as AI first, and we're helping them build their hardware product so this can be deployed. Think of every CVS you go to, corporate spaces where there's employee programs for health. Is where people will be able to participate in this. And so that's another example. And we mentioned robotic surgery. Our most recent investment was into a company that's building accessories for the Da Vinci robot system that does so many abdominal surgeries. And so that is obviously a breakthrough, But as with any major breakthrough, you got to have all the accessories that go with it. And so this was a group of surgeons who said, well, the surgery is great, but I need this and this and this. And so they built a little catalog of new products that would accompany the robot to do these surgeries. So that's kind of our view. We always like to have medically informed things. We want to make sure the data is solid so that it's actually helpful for patients. And then we want to see that the cost basis is going to be very superior to what the alternative would be. And then, we just look for the right partnership opportunities. Medical is so crazy, as you know. There's insurance providers and there's healthcare systems and there's specialists. And so finding the right channel to get into the industry is probably the hardest part.
Yeah, one of the challenges around medicine, I guess, is you're sometimes it's hard to figure out who the customer actually is, right? Who's the one actually paying the bills, so that you can figure out where those opportunities lie. Fascinating stuff to hear about, right? And to think about, what the future of medicine looks like, both from the provider standpoint, but also from the patient standpoint. And, that's another challenge I'd love to hear your thoughts on, right? As some of these technologies are being introduced, right? At some level, there's provider side hesitancy to introduce these, but there also may be patient side hesitancy, right? I remember, again, when the Da Vinci robot was coming out, and you would talk to patients about doing robotic surgery, right? And some of it was misconception. They thought that, okay, we just sort of program the robot and let it go to work, right? They didn't realize that we as surgeons are using it as a tool to be able to do finer movements in smaller spaces, and it can make things less invasive. But AI similarly, right? I hear a lot of patients who now are concerned, right, that they don't want to only be talking to an AI about their health, right? And there's some fear and trepidation around that. So maybe talk about, again, what you've seen from the patient kind of hesitancy side of things, of are they open to having robots moving around the hospital, right, doing all this stuff that they used to rely on the nurse to do?
Yeah, I think the patients are pretty fast to adapt right now. I think when they walk in and see a high technology image created by a healthcare system, especially like a premier hospital, they have an expectation that they need to have the latest and the cutting edge. And if you think about all the new options that are available to patients, whether it's proton therapy, a lot of advanced lab work that goes into organ transplants and things like that, I think your patient that wants the best care in today's environment wants the surgeon or the healthcare provider to have the best tools available. So certainly having robotics in the hallway of a hospital creates that image, right? It's probably the single most impactful thing to a patient's experience. I have not received any negative survey feedback. I'm not sure that people would feel comfortable telling me if they're like, I hate it. Your robots look stupid and they're always in the way. But what I tell you is I get flooded with positive comments. There's not a week that goes by that a citizen that has my cell phone number doesn't text me and say, hey, I was at a hospital and saw your robots. And then we'll usually send me a little video. Or we brought the kids up to visit grandma today and they were supposed to go in the room, but they were in the hallway playing with your robots, right? So my experience has been that it's very positive, and I think we're going to be doing a new deployment right before Christmas this year in a nursing home. And so I'll be able to give you much better feedback soon, is say like, okay, now we have a senior population, strictly senior. What's their reaction? And the first question we got from the skilled nursing facility was to ask us, hey, can you make the robots talk to the patients? So they were already thinking that they wanted to create an experience for their population by having the robotics talk to the patients.
Excellent. Amazing. Well, I want to maybe switch gears a little bit before we wrap up, although it probably isn't really switching gears. I know you have a new book on the way coming out, and why don't you tell us a little bit about that?
Yeah, I'd love to. So the book is called Risk Taking is Biblical. My company, all my companies, I own 5 companies, are all Christian companies. So Christian robot company, Christian venture capital firm, Christian electric vehicle company. So what does that mean? So I use this book as a platform. It's released October 21st. By the time this airs, it may be out already. And risk taking is biblical. I'm going to unpack what it means to take a biblical worldview into a kingdom building mentality. What are the practical steps? And I think you're familiar with the formula of writing a book like this that's technically based, but has to be consumable.
Okay, you're back. There's a
Okay, we
little
might have
glitch
the Wi-Fi there. Yeah, so we have our 12 steps that we're going to walk people through how to take to launch their own risk-taking enterprise, and we cover nonprofits. We cover obviously for-profit businesses, and then, as you know, building a company is not as easy as just having an idea. We're building an organization or a movement, running for political office. Those things don't happen overnight. So if you want to do that, you have to get your own life in order. And here's the steps, the sequential steps that you should take to do that.
Awesome. Well, I'm certainly looking forward to reading the book. I've heard a fair amount about it. And, we connected through the magic of the internet, social media, some mutual acquaintances, and certainly glad we did. This has been a great discussion. For people that want to learn more, follow what you're doing, where's the best place for them to do that?
Yep. If you want to hear, it looks like we got the website up. That's our company website. So lots to read about there. We publish a lot of thought leadership. And then I personally write on both LinkedIn and X. So people can follow me there directly. And it's 100% me, 0% AI.
Very good to know. And it's Matthew A. Chang on X if you're looking for him. And again, the book is called Risk Taking is Biblical, and being released tomorrow as we're streaming this live, but probably already out for those that are hearing it on our podcast feed. So it's been great speaking, Matthew. I guess, is there one last maybe message or anything you want people to kind of know about as they're thinking about the future and robotics in healthcare?
Yeah, I would just say that robotics are coming and they're already there. It's just a matter of how much you'll see them in the future. And I would suggest that anybody that wants to get involved with an opinion, now is a great time to be opinionated and to test your theories. I've gotten opinions from nurses, from doctors, from robot geeks like me, and software and AI people, and everybody likes to have an opinion. The beauty is the future's not written right now, Dr. Ovadia. So whoever gets in on the ground floor now, you can actually be part of what the future industry looks like in driving this new technology into hospitals.
Yeah, certainly. That has, I think, always been my perspective, is to try and be a contributor to building the future, try and be a leader, as opposed to there are way too many people in medicine who want to kind of stay in the way of innovation, and they usually end up getting steamrolled. I'm certainly excited about a lot of the potential for this technology. Thank you, Matthew, for joining us. Thank you to everyone in the audience. Just a reminder, please subscribe and on whatever channel you're listening to this on. We've been doing live streams 2 to 3 times a week. And in addition to our usual podcast feed, it's been great spending time with everyone. and we will see you next time.
All right. Thank you. Bye-bye.